Well, hello everyone. It's Nancy, the nurse practitioner, and welcome to my video today on caregiver success. So I've been doing videos for you guys for the last year and a half because I found there was a great need for people to have the information to stay well, stay out of the hospital, prevent medical crisis, and that means all over the world. So I've taken it upon myself to do research and bring topics of interest to you that are timely and will help you have hope, support, and learn how to take care of yourself and your loved ones so that you can go on having a good time while we all go through these changes in our lives due to COVID and other things that are happening to us, job changes, whatever, based on our family situations. So I'm here to support you, and today we're going to talk about the flu vaccine and how COVID-19 in this time period that's still going on is also part of that equation. So we need to be thinking about the wave of flu coming up and the wave of maybe another COVID outbreak and how we can have the best quality of life and the best information possible. So the information I am going to provide to you is from the CDC and the World Health Organization, and this way you've got some updated, important, and accurate information. So the flu and COVID-19, as you know, is spread by respiratory droplet, and that's why we're wearing masks for the COVID-19, but actually it will also help us prevent the transmission of influenza. And the important things that we're going to go over today is differentiating between COVID-19, the flu, and an upper respiratory infection. And in addition, we'll go over who's at risk, who should get the shot, and the new vaccines that are out there right now, and a couple other things I'll throw in there. So remember that we're all still doing our staying at home if we can. We're social distancing. We're washing our hands and surfaces. We are using good respiratory etiquette by sneezing, achoo, in our elbow and not in our hand, and or using a tissue. It's better if you sneeze in your elbow if you can. And we're also being, careful about people who are sick and people who could get sick, and we're staying away from them. So it's going to continue for a while that we're doing all of that, and we should anyway, especially during the flu season. So the CDC, which is the Centers for Disease Control, and the WHO, the World Health Organization, recommends that anyone over the age of 6 months of age to 59 months of age, and from 50 years old and up, should be getting the flu vaccine. And also people that are in more high-risk groups, those that are immunocompromised, they're getting cancer therapy, chemo, radiation, those type of people. The people who are also have chronic pulmonary issues, cystic fibrosis, chronic asthma, they're on oxygen therapy, they have COPD, those people with cardiac issues, not necessarily hypertension, but people who had open heart surgery or stents or had a history of strokes should definitely be considering and getting a flu vaccine. Those who have had HIV or AIDS and those who have metabolic disorders such as diabetes should definitely get the flu shot. Women who plan on getting pregnant during this season or who are pregnant now should definitely get the flu shot. And children and adolescents who are getting aspirin therapy for or on medicines that have salicylates in them, they definitely should. And we all know that the residents in a nursing home, their staff, their caregivers should all be getting flu vaccines as well. People who are extremely obese, over a 40 BMI or body mass index as well. And something you need to know that if your child has not had a flu shot between the age of 6 months and 8 years old, they're going to need a 2-part series shot, 4 weeks apart. So you're going to want to think about getting that first shot now, so that in 4 weeks you can get the second one. It takes about 2 weeks to titer up for the flu. So you want to kind of get it in September, which is we're at the tail end, or October. And a lot of doctors are not necessarily easily giving the flu shot, so definitely check out with your pharmacies where you can get one. Okay. This year's flu shot will cover 3 to 4 strains of the flu virus that's going to be circulating this season. You know how sometimes it's just I don't want to say the word, but you're never quite sure if it's going to work or not sometimes. So, at least you have some coverage. And do not get it if you're allergic to eggs or you've had any severe reactions to a flu shot in the past. So there are 2 new vaccines out this year for people over the age of 65. The quadrivalent high-dose vaccine for the adults over 65 replaces the trivalent high-dose vaccine, and the quadrivalent adjuvanted vaccine for adults 65 and older is similar to the trivalent adjuvanted vaccine, but it's been replaced. All right. Some non-pharmaceutical interventions we've already gone over. Continue with the washing the surfaces. We're teleworking from home due to COVID, so that's going to help us reduce the flu season outbreak and transmission as well. So a couple things. If you have a fever over 100.4 orally, it's better to just sit tight, stay home, and CDC recommends voluntary isolation until the fever is gone, until symptoms resolve on their own. Don't check your temperature when you're taking Tylenol, because then the temperature will be normal. Take it when you're not taking the Tylenol so you can see what your real temperature is. So we're going to go over face masks. It turns out that the face masks many of us are wearing are not considered the best at this time. For instance, a bandana only covers the respiratory droplet to 7 inches in front of you. A folded handkerchief covers it 3 feet 7 inches, and a cone mask covers it 8 inches. But a quilted mask will cover you pretty far. So it's pretty important that due to the droplet situation that we consider changing our masks. So let's go over that for a minute. I'll show you some masks that I have. And so this is one of the cone masks people are buying that are actually like manufactured masks you can get anywhere. Not recommended for us to be wearing right now if you can help it. It's got to be able to cover your whole face, crimp on your nose, and seal really tight. Not super great right now, they're saying. This one that I'm seeing on a lot of people, which is around the neck and then over the nose, is kind of polyester, and the holes in it are not woven tight together like a cotton product, so you may have transmission with this mask. And also there's no crimp near the nose, it's just kind of dripping hanging on the nose, and there might be leakage here. The idea is to find a mask that covers your nose and your chin, has a crimp up here like this is a homemade cotton mask I made. And something that I do to my masks just to kind of hopefully not gross you out, but I put mini pads, that are disposable every day in my mask like this. And I change them every day, and I make sure that I wash my mask every couple of days in the washing machine, dry it and iron it. I do not take my mask off by pinching it. I take it off one ear, then the other, and then I put it on, on my windshield, my mirror in the car, for instance, where you're seeing everybody hanging them these days. Okay, so that's about the masks. So SARS-CoV-2 is the actual name of this COVID as we know it, COVID-19. It's called COVID-19 by us because it was considered a virus that happened in 2019. But the influenza infections can present very similar symptoms as the COVID. So we're going to go over that because it's really important that you know. And I'm going to supply you with this Excel sheet that you can download from my facebook.com/caregiver success page. This way you could have it, you could tack it up in your bathroom, you could watch for symptoms depending on your family members, your mom, your friends. Pass it around so people have this information so you know how to take care of the flu right away. Because just before we let's go over this for a quick second, is that an antiviral needs to be given to you within 48 hours of symptoms of flu in order for you to eradicate a lot of the symptoms and not get really sick, developing pneumonia, bronchitis, and end up in the hospital. So you really want to know your symptoms early on so you can act quickly. Okay, that's a prescription. You would need to get it from your doctor or nurse practitioner or your PA. You would need to get it at a local clinic or something like that, but it's prescription. And the treatment would continue for about 5 days. It might even go on longer if you need it longer based on your symptoms. Okay, this is a guide. This is not a replacement for your medical care, but I'm just trying to help you kind of sift through the rubble to get the information you need to stay well. Okay, so let's take a look at this chart. So let me just make it a little bit larger. We're going to be seeing the characteristics of COVID, influenza, and upper respiratory infections. if you look in the red section here, let's see if we can make it a little bit. Okay, so you can see that the incubation period for COVID is 1 to 14 days, and it happens median day 5. So about day 5, you start to not feel right. In the flu, it's 1 to 4 days, so it comes on pretty rapidly. The one thing I could say about the flu that's different than COVID is you feel like you got hit by a truck. It happens very quickly, and you feel terrible, you have chills, you have fever, and you want to put the covers over your head. So you pretty much know you have the flu pretty early on, okay? Upper respiratory infections, what many of us have gone through, can happen in 1 to 3 days, and that's specifically related to, congestion and whatnot. Then we have fever. It's common in COVID-19, so that's why we get our temperatures checked as we're going into stores. Fever is rapid and not, the onset is gradual in COVID-19. It's rapid in the flu and it's gradual in upper respiratory, but fever is common in COVID-19 and it's common and severe in the flu. So that's where you like I mentioned, you get 102 fever, you're shivering, you feel terrible, but that's not as common with COVID. It doesn't come on that quickly. And the little stars that you're going to see throughout this chart just means that we're comparing COVID with flu, so you know which one may be which. Upper respiratory infections usually do not have a fever unless you get, which is viral, by the way, unless it becomes bacterial and sinusitis continues, or you end up getting bronchitis or pneumonia or something bigger. Cough is common in COVID, and we've heard that. Cough, it's also common with the flu, and it's also mild to moderate when you have an upper respiratory because of a postnasal drip. Fatigue is common and can be pretty severe with COVID. You just don't feel right, but you don't have a fever. You not sure what's going on. It's common in the flu, and it's mild to moderate in, cough is common and mild, moderate in the upper respiratory infections. For fatigue, it's common, we said severe, it's common in influenza, and it's sometimes present in upper respiratory. Shortness of breath is common in COVID, sometimes in flu, and mild in upper respiratory. In the muscle aches or myalgias, sometimes in COVID, common in flu, because usually you feel very achy and you don't have or may have none or just slight upper respiratory aches. Headache, sometimes in COVID, let's get back on the chart here, common in a flu and rare in upper respiratory. Decreased appetite or decreased taste actually is very common in COVID, but mostly decreased appetite is sometimes in COVID, common in flu, and sometimes in upper respiratory, usually from the drip and just a bad taste. Chills, sometimes in COVID, common in the flu, and rare in upper respiratory. Diarrhea is sometimes, and there's that star again, which could mean that you definitely have had some COVID exposure, sometimes in flu, rare in the upper respiratory. And nasal congestion, sometimes in COVID, sometimes in the flu, common in the upper respiratory, and sore throat, sometimes in COVID, sometimes in the flu, and common in the upper respiratory. I know that's a lot to go over, but the chart is really good. And again, I am going to put it on my facebook.com/caregiver success page. And this is all the information I have for you today. I hope you stay well and consider getting the flu shot. And also check out my YouTube videos on caregiver success and subscribe if you can. Stay well, everyone, and take care. Till the next video. Bye.